Welcome to Keys to the Future. I'm your host, Gabby Coe. I've enjoyed a successful engineering career and want to inspire you to remain focused on your STEM education and career. Join me as I chat with amazing guests who are shaping the future and sharing their journeys to inspire yours. Ready to unlock your potential? Let's dive in. Our guest today is an award-winning biomedical scientist with over a decade of experience. A certified Scrum Master and Agile practitioner, she combines scientific expertise and project management. As a biomedical science lecturer, she is dedicated to higher education and technical level advocacy. A passionate mentor, she champions diversity, equality, and inclusion, leadership, and mental health awareness. She studied applied biology at Brighton Metropolitan College and earned her biomedical science degree at the University of Brighton on the south coast of England. Please welcome Bamidele Farinre. Bamidele, thank you so much for joining us today and sharing your story with the Keys to the Future community.
Thank you so much for having me, Gabby. I really appreciate it for creating this space for our voice to be heard. I really appreciate that. Thank you.
Great. So I have read about your journey and I love to hear a little bit more about it. Your career has spanned many roles in biomedical science and healthcare. What initially inspired you to pursue this path?
Well, that's a very interesting question you've asked because every time I've been asked this, I always have to go back, a few years back as to what actually started the journey. Because initially, from a young age, I've always wanted to study pharmacy, and that's because of the community that I grew up in, where more or less the pharmacist is the first point of contact to healthcare facilities to most citizens. And I see how the impact that pharmacists have in the life of people in providing healthcare and just ensuring that they get timely medical attention really before they're even able to go to the hospital at all. And but growing up, everything was fine and all until secondary school was fine until A levels, where the universe had a different plan for me. That was where I faced my first setback where I didn't do well in my A levels. So and then I had to like redo my A level. And even after that, it was just like a different trajectory for me, looking as if that pharmacy is not gonna be, I won't be able to do it. So when it was time for me to apply to university, I had to go for clearing. And it was from the clearing that they were like, you know what, you didn't get the grades that you really want, but you could potentially do applied biology, which would then lead you to go and do biomedical science. So that was how the journey of biomedical science began. And after graduation, that was another journey of what do I do? Because I didn't know that once I finished biomedical science, I'll end up like in a laboratory. So that was another thing that I had to figure out myself. But since starting in the career, it has been that of a learning experience. It has been that of a challenge. It has been that of resilience and hard work and commitment because being a leader in the space now has come with, of course, years of, hard work and disappointments, really. But having said that, I've learned so much along the way with regards to the value of having a good support system to help in navigating the journey. So, being a biomedical scientist, a chartered one at that, and it's been a beautiful experience. And I'm sure as we go along, I'll be able to share a little bit more about the journey itself.
Amazing. You didn't really let a setback or maybe a couple of setbacks really deter you from continuing on and continuing your journey. So it is amazing. And I also read that during the COVID pandemic, you led the UK or the United Kingdom Mobile Processing Unit VANS project or the MPUV as the scientific lead for the Department of Health and Social Care, mobilizing and delivering 14 validated MPUVs for the rapid COVID-19 response. What were the biggest challenges there, and what were some of the proudest moments?
The biggest challenges I think would have been trying to just ensure in a short space of time to deliver. Because literally to develop the workforce, we had 4 weeks to ensure that the team are ready to be deployed into the field. So it was highly pressured, and it was like the time frame was like really on the toes, having to, the turnaround time, the turnover was really high, and also trying to get the team together and motivate them at the height. That was the peak of the COVID, where even we ourselves as healthcare scientists, mental health was something that was really of concern, but that didn't stop us really, because we know this is something that we had to deliver. And the whole point of that mobile processing unit, the vans, was so that we have a more rapid response, so that people can get their result in a timely manner to reduce the spread of infection. Because if you think about it, the normal way, the traditional way is that you will send, when samples are taken from citizens or from patients, you have to send it to the laboratory. And from the laboratory, you have to wait for, like, Lord knows, from 24 to 48 hours before you get the result. And by that time, they were meeting people, so the infection keeps spreading. So the whole idea of the mobile processing vans was so that we're able to reduce that time span, and then of course for people to be treated in a timely manner, for them to be able to isolate. So the challenges were trying to then train people as quickly as possible and making sure that they're competent, because we cannot deploy without them being competent. They have to be signed off competent before we're able to send them to the field. And then also being able to actually manage expectations, because there's a number of samples that we're expected to test per day. And sometimes, you run through difficulties, like machines breaking down, people not turning up. Life happens. Like if somebody calls in sick, having a backup. So all that was there. And also it was a multidisciplinary sort of project, where different groups of people, different expertise coming together to achieve this goal of ensuring that we're able to test citizens in a timely manner. So those were the challenges. And also, times when things don't go right, as planned, what do we do? What are the backup plans? That's another thing. And also trying to communicate. When you have working on a big project like that, you're working across disciplines, you have different opinions, trying to manage other people's expectation as well as your own, your workload, and that of your team. That was a bit of a challenge. But the triumphs were like seeing us win, when we're able, the days that, yes, this day we're able to exceed expectations, the days that everything runs smoothly. Yes, when the team are happy, there's joy when your team succeed. When you plan things and it goes according to plan. Those were the triumphs. Being able actually to train a biomedical workforce. Some of them were fresh out of university that we had to train, to be able to deploy them. So those were the wins. And more even importantly is that a lot of these group of professionals, they've gone out even after COVID and gone on into the healthcare, into the various fields, and become, experts in their various disciplines that they've decided to go on. So that is really, and also it's just that partnership as well. That is really key. People coming together, forgetting that we're coming from all different walks of life, all different disciplines, all different experiences, and then coming together to achieve that one goal of saving lives. So that was really, really, really impactful.
Absolutely, very, very impactful, and I can see why agile methodology, applying that agile methodology, right, was very key. I was really impressed by you say, being a scrum master and applying that in a biomedical field, applying that methodology to deliver faster. I
Yes.
tell you that because I am an engineer and we use that methodology as well. But I am very impressed that it's being used in other industries too and making an impact to deliver the products that our society needs faster.
Absolutely.
So you've been recognized as a biomedical scientist of the year. Congratulations.
Thank you.
And a champion of medical science. How did these honors impact your career and your approach to leadership?
It's really humbling. Sometimes when I think about it, I'm like, wow, when you're still in that aura moment. And it's just like, it's an affirmation that I'm doing the right thing. I should keep going. It just reminded me of the importance of representation and visibility, especially in STEM. As a Black woman in STEM, being recognized at this level is a win-win for all, really, because being seen in the profession, so we're not like in the background. Like we always talk about women in science, it's really important. And when they see, especially the younger generation, that they're aspiring to be where I am today, it's a win for them to say, I can do it. If she can, They can see a representation. Oh, she looks like me. She's a woman. She can do it. And it's also really inspired me to like lead with intention and empathy, because I know how far I've come, the learning on the path. And leadership for me, it's about creating more opportunities for others to thrive, mentoring the next generation, which I'm really passionate about, passing knowledge really, and ensuring that the diversity of voices are being heard in spaces where decisions are being made, because I think this is really critical, is really key. If we're not where we can have a voice. Let me give you an example. What you're doing now, this space that you've provided, that you've created, you are amplifying voices that otherwise would not have been heard. If you're not giving this space, you probably wouldn't. A lot of people basically won't hear of what is mobile processing unit, what is biomedical science, who is a biomedical scientist, a healthcare scientist. So it's like having that diverse voices, hearing them in different spaces as well. And I think just the winning as well is like reinforcing my commitment to be not just a leader, but an advocate for equity and inclusion in STEM.
Absolutely, and thank you for the kind words too. And that's what I aim to do as well. Amplify those underrepresented groups, and so that they can see themselves in roles that we now hold
Hmm.
because we worked hard to get there. And just to show that if you work hard at anything you want to do, it is possible to get there.
Absolutely.
So speaking of your expertise in advocacy and biomedical science, let's look ahead a little bit. With the ever evolving challenges in global health, what role do you see biomedical scientists playing in responding to future health crises?
Oh, I mean, you can already see it playing out. I always say that virology is my specialty, and we've the COVID being virus of infection, it brought us to the forefront. Whereas people might not have necessarily known about us, we were more in the media. People know about us. We are able to talk about it and explain and give people accurate information. So you can see that the importance of coming forward, of having a voice, of letting the general public know about what we do. So biomedical scientists, we are the backbone of healthcare systems. I always say this, that we are the hidden heroes of pathology, the hidden hero of healthcare. And the reason why I said that is we are not patient facing. So, like, we help doctors in being able to manage patients. Is the result that we provide in the laboratory, the test that we do that helps, in combination of course, the symptoms and the presentation of the patient for the doctors to be able to determine the next course of action for them to be able to manage the patient effectively, for the patient to have, how do you say, improved and a beneficial outcome for them. So we work behind the scenes to provide the critical data that shape diagnosis and treatment of patients depending on the diseases and the infections and conditions that they have. And so in future health crises, you will see that our role will even be more critical, vital, and we ourselves, developing ourselves, keeping abreast of what is new in the industry, like with regards to innovative diagnostics tools, conducting research and informing the general public about strategies and ensuring the quality and accuracy, of course, of the testing that we do. That the onus is on us as biomedical scientists. For example, there are different training platforms that we do, which are mandatory for us to keep abreast, so continuous professional development within our respective disciplines. And we also play a key role in global collaborations. Like we said, we mentioned about the pandemic. We contribute to antimicrobial resistance research, and learning also about emerging diseases. And I think it's really key that adaptability and expertise, it will be really crucial in building like a resilient healthcare system. We're constantly learning, constantly evolving. Like during COVID time, it was like literally a rapid turnaround with regards to the tools that we use, the technology that we had to learn to use to be able to deploy those mobile units to the citizens so that they'll be able to use it for testing. So we keep evolving, we keep learning, and it's just never ending really. But I think more importantly is us being visible so that the general public will know the importance and the role that we play when it comes to diseases, the treatment and diagnosis as well.
That's great. A couple of things that you mentioned is the backbone of healthcare. I think that we the general public doesn't see what goes on in the background. So there are a lot of heroes out there that are making possible the treatments, the providing the infrastructure
Hmm.
and the data. We're such a data driven
Yes.
society now. So you have to have that data at your fingertips. And it's amazing that you said people that are in this field also need to continue to learn and stay abreast of new technologies that are going to help innovate other ways of helping combat disease and be adaptable as well. So that's really great input. And I think that can apply to other industries and other professions. I think
Absolutely.
having that mindset.
Yeah, that growth mindset, because things are changing every day, especially with regards to technology. Like it's ridiculous the new with the advent use of AI now and everything like that. We have to keep up. We're trying to keep
Right,
up.
exactly.
Yeah,
Keep up or stay behind.
that's it. That's it.
And we don't want to stay behind.
We don't want to.
So you've dedicated a lot of time to mentoring and STEM outreach, especially for women in underrepresented groups, as you've mentioned a little bit earlier. What do you think is most critical for creating a more inclusive future in science?
Hmm. I think it's visibility. Visibility is really key. Visibility and representation. Why did I say that? My motivation to become a mentor and a STEM ambassador was because that was something that I genuinely sought earlier on in my career. I did not see it. And I always say this, I said, it's not like it does not exist, but it was not visible. I could not identify with a woman that looks like me, put it that way, that I could say, oh, they are leader in their own way, in the space that I'm in, that I could actually really go to and talk to and probably like mentor me and just put me through really. Like when I graduated, it took me 2 years before I understood that, oh, I had to do a training in the lab before I can become registered as a biomedical scientist. If I had known that, I probably would have planned my university, time before even I graduated. I'll start looking for, trainee roles within the space. But I didn't know that because there was nobody to tell me about it. So that's why then I made it like a mandate for myself that I'm going to be visible. I'm going to represent. I'm going to make information available so that what I went through, which sometimes there's some journeys, there's some hurdles that we don't really need to go through because somebody have already walked that journey, so they create that template for us to follow. Even though we can adapt, of course, and the template is going to evolve, but at least they've got something to work with. And it's hard to aspire to something that you don't see. It's really true. Like it's not most people, they have in their head that okay, I want to be a scientist, but what kind of scientist? They don't know the different opportunities that are available there as a scientist. It's not every scientist that wear lab coats. It's not every scientist that sits in the lab. There are different aspects to being a scientist. And if they don't see, especially our younger generation, if they don't see anybody doing it, they're not going to be able to know what to expect or how to go about their journey. And that is why I'm so passionate about when it comes to mentorships and STEM outreach. Because we need to create pathways for underrepresented groups to access opportunities, especially girls. It's the same for boys as well, but especially girls in STEM, whether through scholarship, internship, networking, and through this mentorship that we're doing, role modeling, because when they see you, when they're like, oh, even though you've gone through all these challenges, you're still standing, you overcame. How did you do it? And it becomes a blueprint for them. It's also critical to challenge all these systemic biases that exist within institutions to create environments where diversity is celebrated and we're not just tolerating it. Like for me, I always say being inclusive is not a checkbox activity. Visibility, representation is not something that is a checkbox. Okay, we got it now. You're there. No, it's got to be impactful, and is a continuous effort to remove barriers and provide support to people. You'll be amazed, like during these engagement activities, you hear a lot of younger ones. They'll be like, oh, I want to do that. Okay, now I've got clarity, because when you have information, you can make informed decisions. So that is what it is about.
Absolutely. I love that you said visibility because I think visibility leads others to
Yes.
access to knowledge, access to role models, access to mentors, access to just the information that they need to make those informed decisions
Mhm.
for, are they going to, do they like what they see in the role models, and do they like what they're doing, such that they can go and do it, try and do it themselves, start their journey and so on. I think that's, you hit that right on the head, because visibility, if others don't see role models that can help them start their journey, getting that inspiration to get started,
Mhm.
then you're always going to be in the background wondering, well, I wonder if I could do this. Well, I wonder where I should go to get the information. Maybe there's nothing. I don't see anything. The visibility is so important. I really like that you said that.
I would say for us in STEM, we need to do more. There's a lot of representation when it comes to media. It's the media people that is representing us. Like they tell us what doctors look like, what scientists look like. Whereas in real life, we know what it is to work in the lab. Do you
Right.
understand? We know test result is not available in 10 minutes. Not all test result anyway. Some test result takes days, some
Hmm.
even months, depending if it's like, let's say, genetic, testing that they're doing. That's not going to be within a couple of days. So we just need to be more forthcoming. We just need to embrace it. Sometimes, I mean, it's not everybody, of course, does want to come out and just want to be speaking. Like for me, some people might think, oh, you find it easy to speak. No, as I'm sitting right here, I'm nervous, but it's got to be said. We've got to open our mouth, we've got to say, because you just never know. Like just one thing that you say might change the trajectory of somebody that is looking to come into the career that you're speaking about. So we just have to represent ourselves positively. That is the way I see it.
Absolutely. I also identify with, public speaking and being afraid to speak in public places, right? Or but you just have to do it, share your knowledge, right? So that others can be inspired. So it's a great step forward, even though it makes us nervous. I mean, I'm a little bit nervous, like right now, right? Also.
Imagine, because you're like, I don't want to say the wrong thing. I don't, but just come and speak. Like it's gonna be like natural, because at the end
Yes.
of the day, we don't know everything, but the little that we know, it goes a long way. It will impact somebody. Someone will learn from it. Like you just don't know where this is going to reach the audience. That somebody might listen and be like, oh, so there is a career that is biomedical science, engineering. What kind of engineering? STEM. What is STEM? Role models. What do you mean by that? What do you mean by mentors? And then this is our little ways that we drop that nugget of knowledge.
Absolutely, absolutely. So, given your dedication to mentoring and inspiring the next generation of STEM professionals, what advice do you offer young scientists who want to pursue a career in biomedical science, especially in challenging times?
It is challenging times, I can tell you that, because coming into biomedical science now is even proving more. I mean, I speak to a lot of younger ones that maybe just graduate really, and they're like, "What do I do? I can't secure a job. I can't do this." And I'm like, that is just that stability, and just giving them the little idea that I know, the experience that I know, I'm able to share with them. Okay, try this, try that. And most of the time, when they follow through with the advice that you give and the resource that you point them towards, it comes out beneficial for them. But I would say to any young aspiring scientist within STEM to say, stay curious, be resilient. And the thing is, always ask, because sometimes we are so scared of speaking. What if it's the wrong question? What if they don't answer me? What if they think I'm silly? Yes, but your silly question, you need to know, because when you need to acquire knowledge, and without asking or seeking or researching, you're not going to acquire that knowledge. The journey is not going to be easy. I can tell you that. My biomedical science career journey was rough. I can say that. Of course, with all these triumphs within it, but so you have to have that mindset as well, that it takes intentionality. You need to be consistent, you need to be adaptable as well, because things happen that you have to be open to learning. Another thing is you need to seek out mentors. The word mentoring might be overused, saturated, but I'm telling you, it makes a lot of difference. Somebody is like going to a restaurant, somebody tested the food, yeah, and they're telling you, oh, this food is not nice or this food is nice. You can either decide whether you want to go to that restaurant, right? Or not,
Yep.
based on the information that you've been given. And if peradventure you go there, you might make a different choice to the menu that that person that gave you that information chose when they went to that restaurant. The same way as well. So you seek out mentors, you seek out role models who can guide you and open doors. You'll be amazed how doors open for people when you ask. Don't be afraid. Advocate for yourself. You have to speak for yourself because we are not mind readers. If you don't speak out, we don't know what you need. So we're able to then tailor whatever resource or advice that we have to when you ask the question, and we're able to go from there. And should always remember that unique perspective is one strength. Every opinion counts, every opinion matters. And I would say, like we mentioned earlier on, the field of biomedical science is thriving on innovation every day, diverse perspectives, which we know that that drives progress. And so I would say be bold, stay committed. You have to do the work. You have to do the work. No matter how much holding you have to do the work. But one thing I would say is never let anybody tell you that you can't do it. Never let anybody tell you that you cannot achieve it. And I'll tell you the reason why I said that. I mentioned earlier on in our talk that I failed my A levels. When I failed, I just didn't fail, but the time that I needed the support, the moral support of my lecturer, the lecturer told me then, she said, Bami, I don't think you have the head for science. You did really bad. Like, go and find something else to do. To be honest with you, in this day and age, especially with the generation that we're in, if they hear that, they may be like, maybe it's true. If it's not true, how can I fail? It doesn't make sense. I need to do something else. So, just believe in yourself. It's hard, but the way that you can stand and believe and stay true to yourself is when you surround yourself with the right people, right, that have the right energy, positivity.
Yeah, I love that. People generally like to talk about what they're passionate about and sharing their knowledge with others, just like we're doing right now.
Mm.
But you also said something that you hit it right on the head too, is that build that community around yourself of the people that are going to see you through the challenges and also celebrate your victories,
That's true.
because that's also important.
We can't do it alone.
No, absolutely. No, we can't do it alone. You've got to have that safety net. So
Yes.
you've mentioned how fulfilling mentorship is for you. Just got through talking about mentorship and how important that is. Could you share a memorable moment that has made a lasting impact for you?
Oh wow, I've got so many. It's amazing. But I think one simple one, because the reason why I want to use this is because sometimes when we think of mentorship, we're thinking maybe somebody needs so much help, trouble, and things like that. But it can be as simple as they just lack confidence. They've got all the resources they need, they've got everything, but they're thinking, can I do it? So one of my most rewarding one, it was with mentoring a very young lady. She's just very new to she was a graduate and trying to secure a role within the biomedical space. She lacked the confidence in her abilities. I mean, she did really well in her studies, but she's thinking, oh, I don't think I'm doing interviews, I'm not doing it well, and things like that. But having one to one with her and sharing with her, I always like to share that of the fact that I failed, because people always see successes. They don't see the failures, they don't see the challenges, they don't see the hurdles. So when you tell them that, look, life is not like smooth sailing. There are times where you have to overcome this challenge. For even I let them know it's not all the time that I have the confidence, but I'll still do it anyway. I give examples of sometimes I apply for jobs that I'm thinking you don't even qualify for this, but I still go for it. I say worst case scenario, they won't come in for an interview. And that is true. But I've taken that time to submit my application, I've put my all in it. It's a reflective time for me. But over time, she grew confident, into a professional, and now she's really doing well, as in doing really well. And like we still spoke about a few weeks ago, and she's like, "Oh, you need to tell me how I want to be a STEM ambassador as well." That's what I'm talking about, building leaders, because it's not about you learn and then you leave it as that. No, you need to hold somebody's hands or bring somebody else along with you. That is why moments like this in mentorship, it matters to me when those that are mentor, when they win, when they triumph, when they do well, just based on even just simple thing. And sometimes I don't have all the answers. Sometimes I may have to send them in different direction. I may have to bring somebody else to speak to them. But the fact that I'm available, that is really important. And it's about unlocking that potential, helping them see what they're capable of. A lot of the time, aside from my family members and friends that are being supportive, if somebody don't tell you that you can do it, even though you know you can do it, sometimes we need that confirmation. People might be like, oh yeah, no, you just need that confirmation that, you know what, you've got it, you can do it. So a piece of advice that I always share is don't wait for the perfect opportunity, create it. I became a mentor not because somebody told me to. It was a need. And I thought, I need to fill this shoe. I need to fill this gap. There's obviously a gap. I want to fill it. And that's how I've approached it, in my own career. And it's like a mindset that I always encourage others to adopt as well.
I love that story. You absolutely created a chain reaction by helping your mentee. Now she feels she can mentor others and be an advocate herself for others. So that's a chain reaction that then will continue on.
Mm.
Absolutely. You're involved in many roles promoting diversity in STEM, we've been talking about. How do you see the landscape changing for women and people of color in science?
There's been some progress. There's been
A
some
little bit.
progress, but we still have a long way to go.
Hmm.
We still have a long way to go. And that is why, what, for all the things that I get myself involved with, I'm very intentional. And I always like this statement of creating opportunities because you'll be amazed. There's a saying that if they don't give you a chair by the table, bring your own chair. And
Hmm.
that's what I've been doing
I
throughout my
love
career.
that.
No, seriously, you bring your own chair. If you want to stand, stand. Just be by the table. It's so
I
true.
love that.
Seriously, that has been my mantra. That has been like a lot of the things that I've done, that I've achieved is because I just go for it. Yes, I have people telling me, are you crazy? I've got people telling me, oh, it's not time yet. I've got people telling me, you want to run before you can walk. I've had people
Interesting.
make statement like, you want to ride with the big boys. Who are the big boys? I'm a big girl.
Right. I love that. I love
Let's ride
that.
together, But
Excellent. Yeah. Yeah.
yeah,
You
and
just have to have the mindset. Yeah.
yeah, because
Uh-huh.
sometimes we wait for people, we wait for systems, we wait for organizations to do things. I know it
Hmm.
can be tiring, it is tiring, but from your little, in your own little way, what can you do?
Yes.
And you mentioned
From
about
where you
creating a
sit,
ripple
how
effect.
can you lead from where you sit?
That's it.
Exactly. Yeah.
That's it. Creating that ripple effect, like you said. So it's about, yes, the organizations, they need to prioritize, diversity more, inclusion more, but it's not about being a tick box. It's something that has to be imbibed. It has to be systemic. It's got to be systemic. And one thing I found is, yes, we have leaders. Myself, I'm a leader in STEM. As a Black woman, I'm a leader in STEM, but there isn't that many of us. I don't want to be the only one.
Right.
I don't want to
It's
be the
more
only
fun
one.
with more friends.
Exactly. It can be lonely at the top. There is a song that says lonely at the
Exactly.
top. It
I
can
love
be.
that.
So we still have that representation at leadership level. It's still lacking. It's still really challenging, difficult for women to get to leadership. And it's not like we are not, there's so much skills out there,
Hmm.
expertise of women, because we are constantly developing ourselves. We're constantly trying to have a voice,
Right.
especially for women of color, not just women of color, women in general. Different. I always like to term them underrepresented. Any group at all that is underrepresented, more
Yep.
needs to be done. The systemic barriers need to be broken. That even brings me to say, and there's a systemic change that needs to happen, that is needed for the landscape to change. I always optimistic. There's a growing network of allies. I can say that. There's a growing network of mentors, as we keep saying. There's a growing, network of advocates who are committed to creating a more equitable space for all in STEM. The momentum is building definitely, and I'm proud to be part of that change because I am in it, so I know what the change, what the momentum is. But the momentum is a little bit still slow. There is this space that I have on LinkedIn, and I call it BAM space no ceiling. I'll tell
Mm,
you how that came about. The reason why I say BAM space no ceiling is because every time I'm hearing, especially as women, we're shattering ceilings.
yes.
Yes, you have to break barriers.
Yeah.
But every time, why is there so much barriers? Why is there so much ceilings to how far you can go, especially in your professional space? You find that you get to a certain level in your career and you're stuck. Why is that? And it's not the same for our male counterpart when you think about it. So I say no ceiling. I say I don't want to be breaking ceilings all the time. Like, I mean, it depends on how people want to see it because some might hear me now and they be like, "What do you mean?" Yes, you have to constantly break ceilings. You have to constantly evolve. You have to develop yourself. I'm not talking about like that. I'm talking about the ceilings that stops us from reaching our true potential, from fulfilling our destiny, being the best of ourselves, and always coming as our best. Not
Excellent, excellent. So before we close, where do you see your work in the field of biomedical science heading into, like, say, the next decade?
there's still a lot of, I mean, there's still a lot of work to do. See now, as biomedical science. I know that biomedical science is part of STEM, so I say we becoming more interdisciplinary, not working in silos, more collaborations, within different professions within the healthcare space. And we mentioned about advancement in AI earlier on, data science. We're talking about personalized medicine. This has been in the limelight for a long time. We've been talking about personalized medicine shaping the future. I mean, with my own work, my own contribution to STEM as a leader, I just want to continue to advocate for equity in STEM because that's really key. I want to continue mentoring the next generation. I want to continue being a positive role model, continue to bring innovations that improve patient outcomes, not just for patients, but the general citizens, for the general population. And I feel like the future of biomedical science is definitely bright because we're not going anywhere. We've been hidden, but we just need to be at the forefront. We just need to come forward more. And I'm just excited to be part of this constantly evolving field that evolves to meet the needs of the society. So the is nonstop. We keep moving, and I'm thinking more on a global scale, not just local, national, just on a global space.
Thank you so much for sharing your journey with us. I know our listeners have taken away so much from this conversation. I really appreciate your insights and your time.
Thank you very much. It's been a pleasure. I really have had a good time.
And that's a wrap for today's episode. Don't forget to follow Keys to the Future on Apple Podcasts, Spotify, or wherever you listen to your podcasts for more inspiring stories and industry insights. Until then, keep innovating and stay curious.